Hi.
Hello, hello. Are you able to hear me okay?
Yes.
Okay, perfect. Um, so I guess we can wait maybe just for a minute or two to kind of let some people join. So I see that some people are joining, which is great.
Oh, that's sweet. Sure.
Okay. Okay. So I guess we have 6 people watching, which is great.
Yeah.
Um, I guess we can get started. So thank you everyone for joining thus far. I see that we have quite some people joining us. So my name is Harkit. I have Ashley and Krystal,
Hi.
who are 2 wonderful registered nurses outside of Orlando, Florida. I'm Canada-based. I am a registered social worker. I work in addictions and mental health, but today we're going to be talking all about the nursing profession. And these 2 wonderful ladies have a podcast that they've titled "The Nursing Enthusiasts." I can never pronounce it properly, but they're tagged there. So essentially, why don't we then start off this interview? Um, so Ashley and Krystal, why don't you tell us a little bit more about how you started your nursing journey or how you got into the profession?
Okay. So for me, I started as a patient care technician, where
Mhm.
not only my PCT license, but just EKG and phlebotomy, and those things allow me to get amazing jobs in a hospital system that allowed me to have one-on-one patient interaction. And those interactions are what allowed me to want to further my education and want to pursue nursing. So just to be someone's light in the world, make a difference, and just not only just expand myself, but just to be a better
Mhm.
and be a better me for my patients as well.
Yeah, no, absolutely, absolutely. That's amazing. And how about you, Ashley?
I started my nursing experience as a patient care technician as well. My mom, actually, our mom, she's a nurse for over 25 plus years. She works in hospice, and she kind of just inspired us to, obviously go for what we believed in, but she also directed us, nursing is a great profession. It's a great field. So she directed us to kind of start, as patient care technicians and to get that, feel for what the nursing field may be. So I also have
Mhm.
certifications in patient care tech. I am certified in phlebotomy and EKG, and I have great NICU experience before I became a nurse. So that's a
Mhm.
little bit of my background before I, became a labor and delivery nurse.
Yeah, no, that's wonderful. It seems like definitely kind of the passion to get into nursing is definitely there, and I can see that. But what would you guys say is kind of, your daily kind of motivating force, or really kind of um that force that kind of makes you go into work every day and be like, you know what, this is what I'm going to be doing. This is what I'm here for. What would you really say is kind of like that passion that drives you?
Well, my patients drive my passion. I love they inspire me every day to go to work and to just give my all to my patients through their stories, through their birth plans, through their journeys. It just inspires me to be a great nurse and just be present for them. So
Mm-hmm,
it just be awesome.
Um,
mm-hmm, mm-hmm.
it's just knowing that it's bigger than me, and just knowing that patients and family members, they trust you and they just invest and put their lives in your hands, especially me as a preoperative nurse. Like patients,
Yeah.
they're afraid going into procedures, and it's up to me to console them and to just provide that extra support for them. So
Mm-hmm, mm-hmm. And with that being said, what would you guys say kind of led you to kind of build your own podcast? What would you kind of say um, kind of inspired you to kind of build your own platform?
Well, I would say that we have a lot of great people working behind the scenes and helping us and just guiding us through this process. Many
Mhm.
people are definitely great nurses. We love what we do, but some people, came to us and like, you guys are so inspiring. You guys
Yeah.
get on a platform and just give your all and just speak on your, experiences. The Nurse Enthusiast is something that was created a few years ago that, was just supposed to kind of like, start out as just, t-shirts and stuff, but we definitely, once we became nurses, we said, you know what, we have a voice. So we definitely want to use this platform to inspire nurses to change lives and to just, be great overall.
Yeah, and it's just
Mm-hmm.
overall matter of just giving back, because there's so many people that do reach out to us that you don't know like who could be watching on the other side, and just to
Right.
that inspiring force is just, it's a great experience for us, and it just allows us to not only relate as nurses, nursing students, medical professionals, but to just come together and unite in just an amazing way. So that's
Mm-hmm.
Sure,
also
for sure. I definitely agree.
awesome.
Mm-hmm. Mm-hmm. No, and that's fantastic. And in regards to this podcast, um, if we're kind of relating it back to kind of like the bigger idea of, providing other, for example, nursing students and other nurses, essentially kind of like almost like the space, right, um of being able to kind of have this collective space to really kind of talk about everything and anything nursing related. That really sounds like a very amazing idea. And so if we kind of go back to the nursing profession, and as everyone knows, we continue to be in the era of COVID-19. What would you say, what have your challenges been? Either, you yourself as a nurse, or even when you were a nursing student, or what you're seeing amongst your coworkers. What would you guys kind of say are right now currently the challenges of being a nurse in the era of COVID-19?
In the era of COVID-19, being a nurse is definitely challenging. It takes a lot
Mm-hmm.
of resilience, it takes a lot of, strong will, and just being dedicated and just remembering your why. Because a lot of, nurses have completely just quit the career itself. And that's very unfortunate, honestly, because it's such a great, career choice and passion, because you're just definitely passionate for your patients. So just the burnout, the short staffing, we deal with
Mm-hmm.
physically work in the hospital setting right now,
Yeah.
but we witness it. So it's just definitely just being there and just remembering your why. I personally believe that's like the best thing, the advice to give.
Yeah, I would definitely say the pandemic has changed a lot of things in terms of patient ratios, nurses physically, mentally just exhausted and things like that. But as she also said, it's your why that keeps you driven and just keeps you going in those daily challenges. And it just allows you to revert back to why it
Mm-hmm.
all started. So those things allow you to not only like keep pushing, but, keep going as a nurse,
Yeah.
I would say.
For sure. Like,
Yeah.
remember your
Mm-hmm. Mm-hmm.
will get hard.
Yeah. And so for those of so we have quite some people joining in, which is amazing.
Hello.
And thank you for everyone's comments. So for example, so I'm Canada based. So my reality of and I'm not a nurse. I'm a social worker. So the realities that I see kind of on the outside in regards to the nursing profession, there's just a lot of kind of complex layers that are currently going on within our healthcare system. And so what I see is that nurses are struggling from a mental health perspective, from a well-being perspective. Their wellness right now is really is definitely suffering. So so to that point, I kind of want to know a little bit more about how do you guys cultivate wellness, or what do you do to maintain your well-being while you do this profession?
Well, definitely, I would suggest like kind of like finding a hobby or finding something that kind of like you can get away from. Our podcast is definitely like our thing.
Yeah.
Our
Yeah.
getaway. It's our theme is like life beyond the bedside. So definitely
Mm-hmm.
means like it's life beyond the bedside. What is your life, consist of besides just working 12 hours? Working 36 hours.
Yeah.
Something else that's gonna take away that that get away from work.
Exactly. Like, what is your life like beyond the bedside? You cannot pour from an empty cup. So it's very important that you pour into yourself so that you can pour even more into your patients.
Definitely.
So not only being present for your patients, but show up for yourself as well.
Yeah.
So that
Mm-hmm.
back, and patients can see that, and family members can see that, and they can feel just overall wellness from that alone. So practices that I incorporate in my life is I try to do the spa at least once a month. Um, that's just a really good thing for me. As Ashley said, she
I like
buys
to buy
flowers.
flowers.
Yes.
It's my thing. People may think it's completely crazy. Why are you buying yourself flowers? But it's bigger than that. I tell anybody, male, if you're a male, buy yourself some shoes, buy yourself a cologne, buy yourself something that's going to make you feel good about yourself. That's going to say, I did a good job today. I had a great week. You know, I was a little stressed, but I'm going to do this for myself.
Yeah.
Women, if you want to buy yourself flowers, don't wait for a man to buy you flowers. Buy yourself flowers. Do it for yourself. Encourage yourself. Push yourself, you know, that makes you feel like a whole person. That is your thing, then I would suggest doing it.
Also for myself, I'm really big on Pinterest, so I revert back to a lot of motivational quotes that help me through my NCLEX exam and even my daily stressors when I deal with work or just social life or personal life. So in your life.
Oh, I think you. Oh, okay. No, definitely. Those are amazing ideas, and I think, you know, self-care. We always talk about it, but do we actually do it, right? So I think that you guys both provided some, you know, some excellent inspiration and some excellent ideas in regards to what self-care, you know, realistically looks like, because I think often, you know, and perhaps you guys might see it too on your feeds, but it's always kind of this, you know, that we should always be kind of going and doing and just constantly kind of on the go. So I think, and so would you say that your podcast kind of, um, one of the focuses, you know, for nurses is to really just kind of like, hey, like slow down, right? Because your kind of motto, you can say, is it's kind of like beyond the bedside. So to me, what I'm kind of hearing is that, you know, the podcast is definitely kind of an opportunity for you to kind of, you know, talk about wellness and talk about self-care. Yeah. So with that being said, what other topics would you would be covering in your podcast?
Well, some of the topics that we decided to cover in our podcast were, you know, topics on lifestyle wellness, mental health. What else, Krystal?
Physical health, just overall health in general, nutrition, things that just bring a person to be well inside and out.
We also wanted to touch on a lot of things that are going on in society, things that we see in the news. Race is a big topic that we definitely, as African American nurses, we want to speak on our platform about that, because that is very important.
Exactly.
So these are just some of the topics that will be coming very soon on Tune In.
Yeah, no. That's definitely really important. And I think in regards to if we're going back to this idea of well-being, and what's really important that both Ashley and Krystal that you mentioned is, for example, being African American, and how and essentially understanding how race really impacts your experience as a nurse, and kind of bringing that for essentially in the forefront, highlighting kind of the realities of nursing, right? So I think that you guys both bring a really critical point forward in essentially talking about these things, and essentially naming race. So with that being said, I know we kind of also talked about a little bit about the pandemic and a little bit about kind of you know, the stressors and whatnot. But what else would you guys say, you know, within your podcast? Would you say that perhaps you'll be exploring more into what it means to be an African American nurse, what the current realities are, the experiences, and so on and so forth?
Definitely. I feel like it's just important to bring what's in hospital settings throughout, you know, just different nurses' experiences that we've touched base with. We have a lot of friends that are nurses. We have family that are nurses that are also African Americans that have all dealt with different, you know, trials and challenges. So I definitely feel like a topic that we will discuss as we come together and kind of like hash it out and speak about, you know, our different experiences to bring to our podcast.
Okay. And so Can you touch a little bit more about your experiences that you would want to share for new nurses, or just really something that you think is really important that people who are watching this live need to know when it comes to to the nursing profession, to even going back to nursing school? Do you think that there's something that you um, uh, essentially learned from your experiences thus far?
Yes.
Yeah.
So a few things I would say,
Mm-hmm.
and never doubt yourself, whether as a student
Mm-hmm.
or a practicing nurse, because trust your gut and your judgment, because most of the time you will be most likely right, and you can save a life just by doing that automatically.
Right.
Also, you're here for a reason, so never doubt yourself. As I say, I revert to my Pinterest motivational things. Find your thing that works for you and just gets you pumped up and allows you to continue on. Also, none of your studying will go in vain. Everything that I have studied has presented itself at the bedside, so your studying will never go in vain. It will be useful and beneficial on your journey, not only as a student, but as a nurse as well.
Mm-hmm.
Don't settle. Find your niche. A lot of nurses will try to tell you to start at med surg or telemetry to build your way up. But if you have a specialty in your heart and you found your niche internally, pursue that niche. Don't just sit on it, and don't just play it safe. Allow yourself to pursue that niche and just be the best you that you possibly can be.
Mm-hmm.
Say that because starting as labor and delivery nurse, a lot of people told me that I couldn't do it. A lot of people told me that you wouldn't get that specialty just coming out of nursing school, but you have to be determined, you have to be resilient, you have to be strong, and you have to kind of know what you want to do. I feel like the best
Mm-hmm.
advice I can give anyone that wants to pursue the career of nursing is to, know why you want, like, remember your why and know why you started throughout the process. Like, remember why you started, because there's going to be difficult times that you may deal with. You want to kind of quit, you want to give up, this test is too hard. Like, we went through nursing school kind of basically together. Like, we studied together, we did a lot of our stuff together. Like, we're sisters, but we are nurses at the same time, where we had to like actually go through challenges together, but we definitely built each other up, we encouraged each other. So find even a friend or someone of the same like level of mind, where you guys both do the same thing, like both have similar goals,
Mm-hmm.
like me and my sister. So definitely build each other up, and that can go for even if it's not a friend, maybe your partner, just someone that can encourage you throughout your process. Find someone that can help build your spirits.
Definitely.
Mm-hmm. Yeah, no, and I think that definitely relates back to that wellness piece, right? Of the fact that, with you being a nurse, to maintain your wellness, you need the support of others, and you need kind of that backbone yourself. Because to me, what I'm hearing is that you're providing all the support and care to your patients, but you also need someone that is able to meet those needs as well.
Definitely.
And I think that, relating it back to your podcast, I think that really gives you an ample opportunity to be able to do that for your fellow nurses and the nursing community, with a particular focus, I think, for example, we were talking about race, right? Naming yourselves as an African American, nurse, that in itself brings a different experience, a different lens. So I think that really ties, great with kind of what the overall theme is with the podcast.
Right.
Yeah. Mm-hmm. And so I'm just going to go into the comment sections. I think we have quite some wonderful viewers, and thank you for everyone's comments.
Thank you guys. You guys are all amazing.
Yeah. Mm-hmm. Yeah, and if anyone has any questions or they want, to ask anything, you're more than welcome to.
Do you guys have any?
To drop a comment? Yeah. If anyone has any questions at any point, you're more than welcome to drop that in the chat. But essentially, kind of going back to this idea of essentially of wellness, right? Of kind of breaking down what wellness means, kind of going through the realities of nursing. What would you guys kind of tell your younger self, if you were to kind of go back in time, that, hey, this was something I was going to face as an African American nurse, or this is something I was going to face, in my studies? Or would you say that there was something that you would tell your younger self? And my question is twofold. So I'm gonna let you answer this question first, and I'll ask my second part.
I thought about this earlier, and I believe my younger self is like my little sister. Our little sister.
Mm-hmm.
She's about 16 years old, and she likes to do everything that we do. That we do. And I feel like it's so important for us to lead by example. And so she can have some people to look up to. When we were a little bit younger, I feel like when I was a little younger, I wish I had someone like myself, or like my older sister. She's a paralegal. She's watching right now. But like her, it's just like my sisters, to look up to, someone to look up to and say, okay, this is the way, this is the roadmap, this is the guide to kind of follow to get into college, or to be a nurse. Like there were certain, things that, like, what we're trying to promote right now, or positive things like what we're promoting. It can, inspire someone to take that route or to do something different with themselves. So I feel like it's so important to provide that, even, if I didn't have that as my younger self. What do you think?
Definitely. What would I tell my younger self? I would say that you did make the right decision in pursuing nursing and just healthcare in general. You did make a significant difference in patients' lives and family members' lives, and also the roadmap that she was referring to with just younger upcoming nurses and just upcoming students and people that want to pursue the profession. So just being that force and just that example is just rewarding in itself as well.
I think that it could be a challenge, to be honest, when you're coming straight out of like high school. Some people are very lost. They don't know what they want to do. They don't know if they want to be a doctor, do I want to be a nurse, do I want to be a CRNA, do I want to be this? You just don't know. Some people are kind of like forced by, family members, or they're like, I should be a nurse because my mom said be a nurse. Yeah. My dad said, my family's, I come from a role of nurses. I come from a house full of nurses, which we kind of do, but we do. My family is full of nurses. I think about 15 plus nurses are in our family, in different specialties too. So we're all, we're all good. But I mean, that's not why we decided to do it. That's the thing. We all love helping people, and we're all genuine about our passions for helping people. I think we have some
Yeah, so no, and that's great. And I think even in the chat, we actually do have a couple of questions. So why don't we go through some of them here? So one of them comes from Sony D. So what advice would you give to upcoming nursing students, and how to prepare for nursing during a pandemic?
Oh, did we go through? We went through nursing school during the pandemic recently. Well, yeah, like kind of like we went through it. Just kind of like being self-motivated, because you're gonna have to teach yourself a lot. I'm not even gonna lie.
Yes, a lot of self-teaching during the pandemic. So just motivating yourself and just allowing yourself to learn even out of school hours, it would be beneficial to you.
Some references that I personally use that any nursing student can use is Registered Nurse RN on YouTube. I watched all of her videos, especially studying for NCLEX. And Nexus Nursing is a very great resource. I would say she's amazing. Awesome. Like, she picks out the questions and she refers back, and she just gives you that, that knowledge that you might miss, and that, that you can pick up for the next question. She's definitely a great resource.
Also, Simply Nursing. He gives a great general, broad overview of each topic, and just allows you to navigate properly.
Those are different things we use during nursing school, but self-motivation is definitely a big factor, because after, the lecture is closed, it's now time for you to kind of pick up and try to learn what you just went over. And when you're in your home, it's kind of unless you're really structured, where you're not in the bed studying, you have to kind of prepare yourself, get that coffee, get in the chair, and act like you're in that classroom setting, because if you don't do that, you're just going to be like, those off.
Yeah, no, I think that's, I myself also finished my degree at, I think I was in my last year. I was also impacted by COVID, and myself being in social work. I don't know if perhaps you guys did perhaps have your nursing practicum during COVID, because I had to do that. I had to do my social work practicum. It was like the height of the pandemic, like September 2020. So not being in nursing, I can definitely relate to kind of like that overall aspect of, studying from home. It requires that self-motivation, and it just kind of poses a whole new set of challenges. So I can definitely relate to that as well.
Uh,
I'm just gonna go through the chat here. So we have, let's see, what can we expect from the podcast?
What can we expect from the podcast? Definitely just down to earth, bubbly, amazing us, our natural selves, our raw selves. Definitely some, fun facts about us, things that you never heard about, from us, or, it's just really getting to know us as people. I think it's just like our natural selves. It's not like that uptight, you know, general thing that you probably think, oh, what is it,
Yeah, and you can also just expect to just learn new ways to better yourself
hmm
internally,
Mhm.
physically, emotionally, in your profession, and just personal
And you'll
from your
definitely get,
practices. Sorry.
no, go ahead. I cut her off.
But yeah, from your daily practices and activities, you can not only modify them, but just create better habits that will just benefit you in every aspect.
And also be prepared to hear from some great guest speakers that we have prepared for you guys. Some nurses and just medical professionals that are definitely interested in exploring different, topics with us and promoting their businesses as well. So we're all for it.
I'm just going through the comments. I think, oops, did I just press? So I think there's two more questions. I just kind of want to give a shout out to it's Christina. I don't know what the reference is, but yes, very influential. P.S. I'm the younger sister. Let's see. I think there was a previous question I might have missed. So I think we kind of touched about this, but any adversities at the job, being a new and young registered nurse, would you guys say that there's any specific stories that maybe stand out to you?
Well, I won't give personal stories because of, patient. That's just like our
Right.
the focus on it.
Yeah.
Stick to. But I think just like kind of getting settled in my specialty as a labor and delivery nurse was definitely a challenge. Getting to learn my field, getting to learn, the ins and outs, getting to learn the doctors that I had to work with. And, a lot to deal with at first. But I feel like it took me a good 6 months to kind of just step away from social media, try to have my all. I literally moved from a new city. I moved from South Florida because that's where we're from. And I moved to Orlando, Florida, and I transferred to one of the top women and babies hospitals in the nation. And we deliver a lot of babies. Okay. We deliver a lot of babies, and I work at the baby factory. So for me, it's getting used to a lot of deliveries, getting used to the process, and just trying to be an overall great nurse and just gaining that confidence, which I feel like I gained.
Absolutely. And Krystal, anything that stands out to you in particular for you in regards to your nursing experience?
Just adjusting to my new unit, adjusting to the cases and the surgeon's preferences. Every surgeon wants something different. So just adjusting in that area and just best representing my patients in that area and being that advocate, being that compassionate source that they can refer to pre-procedurally. And yeah, things like that.
Okay. And kind of going back to the podcast, do you guys have an expected, time frame in regards to when your, episodes will be released or when your first episode will be released?
We're still, me and my team, well, our team is still working on a drop date. We're trying to decide. It's going to be maybe in the upcoming week or so. So just,
okay.
for that.
Okay.
Definitely excited about our first drop, and just can't wait to bring it to your attention. Get to know.
Okay. So there's also another question here in the chat. Let's see. So kind of going back to kind of like your experiences within nursing, how would you can you talk a little bit more perhaps about how do you manage other staff's emotions when things kind of get a bit hectic at work?
Personally, I would say just offering my presence in any way possible, any encouraging source of information that I can provide, as well, just promoting those motivational things that I tap into through my Pinterest. I'm that. Also, as well, helping in any way that I possibly can, offering my services, myself, helping with other patient assignments
For
if
sure.
possible. So those things are very beneficial and helpful to my peers that may be drowning at the moment.
I see little messages on Instagram that nurses have love languages as well. So like providing service and just being there for your other, like, you know, fellow nurses, and just supporting them when they're like having a tough night or, you know, tough shift, and just like kind of they are drowning in an assignment. Just being there if they need something at the moment. We all how I look at it at my unit specifically is that we all share our patients. Like no one's patient specifically belongs to one person. Like we take care of all our patients as one. If my patient, my other nurse, her patient needs something, I'm going to bring that to them. I'm going to help them. As long as I'm okay and my patients are okay, we're all okay. That's how I look at it. We're a team effort. So definitely in a hectic situation, providing, you know, service and just, you know, providing like, you know, care.
Same with my cases. Teamwork makes the dream work. So the faster we can get the patients into the OR and work collaboratively, it's just the most beneficial way.
Definitely.
Mm-hmm.
Especially in emergency situations, you have to act fast.
Mm-hmm. Okay, so it seems that, you know, nursing in itself is not a very isolated kind of ordeal, right? It's very involved with your coworkers, with
Oh
your
yeah.
colleagues, and that sometimes wellness really looks like is not really so what I'm hearing is that wellness, you have to look at it from a very collective perspective, right? Because sure, things might get, you know, a bit, you know, stressful with your coworkers or colleagues, but overall you kind of need that kind of collective approach to kind of make, you know, to allow your job to kind of go smoother, or, you know, at the end of the day for things to really get done.
Definitely. For sure.
Okay, okay. I'm just gonna go through the chat here. Oh, um, another question for you guys. So what's so before I get to that question, because I did have another question in mind. But yeah, no, I totally also can relate to you know, to being in the helping profession. I think, you know, relatively, if we look at social work and nursing, both being helping professions, I also understand that sometimes you know, you have coworkers or colleagues that um, you know, there's definitely those stressful encounters, those stressful moments, but at the end of the day, you kind of need them to make things kind of flow. So I totally relate to that. Um, and with that being said, so that wasn't really a question, it was a comment. But with that being said, you know, what would you kind of tell other nurses? What can they look forward to kind of, you know, with the job, or just, you know, with being a student, what would you say is kind of like your piece of advice?
My piece of advice is that it gets better. If you're a nursing student and you are drowning or you feel like you just want to give up, it gets better. I can't say that, you know, being a nurse is like, oh my gosh, you know, in this moment, it doesn't look amazing, but it is, because you having, you know, that experiences with your patient, when your patients tell you that, you know, you helped them so much, or thank you, you changed my life, you saved, you know,
Mm-hmm.
my baby, or you did something for them. That is life changing. That is purposeful. That makes you feel like you know, you're amazing. And I can just say that, you know.
Definitely. I would definitely say be ready, because you are going to change lives. You are going to touch hearts. You are going to be someone's light, someone's last hope, and someone's hero. So it's
Definitely.
very important that you just take the profession and treat it as such. So those things just allows us to not only change lives, but it motivates nursing students and just nurses as well.
Yeah, so with all that's going on social media right now, we see a lot of people posting then saying like, you know, nursing sucks right now, but it really doesn't. It really doesn't. It's just hard
Mm-hmm.
right now. We're going through a hard time, but as nurses, but I think if we all stick to, you know, what we need to do and stick together, I think that amazing things can happen and change can happen as well.
Definitely.
Mm-hmm. Mm-hmm. Okay. And would you maybe be able to kind of provide like a little snippet of what your day-to-day kind of looks like as a nurse, perhaps in each of your different units?
Um, my day kind of looks like my shifts. I work night shift, Crystal workstation.
Mm-hmm.
My shifts kind of look like either having patients that are going to have vaginal deliveries or maybe some C-sections. I work in a labor and delivery unit. We deliver, I want to be very accurate when I say this, but we deliver almost 1,000 babies a month. If any of my nurses are watching, don't quote me. But I work at a really busy hospital and we deliver a lot of babies. So just kind of like being there, being knowledgeable. I think being knowledgeable is a very important thing in labor and delivery because your patients have so many questions for you and you should know how to answer them on site because they're worried, they're concerned, and they want to make sure they're getting the best care. So I'm always educating, I'm always providing care to my patients, I'm always, hands-on, I'm always in the room, I'm always giving medications, I'm always working. So I think it's just being on alert and just ready to work.
Yeah, so in my area in pre-op, so we basically overall our goal is to prep the patient for procedures in the OR. So we would just admit the patient, get our set of vitals, get our admission assessment done, and any consents that will be needed for the procedure, just ensuring that the procedure goes as smoothly and safely as possible. Also, just consoling our patients and providing that emotional support because surgery is scary. So it's just like just offering our presence and being there and just helping in any way that we can so that they can safely make it to the OR and have a successful procedure. So that's my job.
Okay, wonderful. So I'm just gonna look through, oops, just gonna look through the comments again. Does anyone, oh, we do have some other questions here. And just kind of eyeing on the time here. So we're almost actually close to the 40-minute mark somewhat. So if anyone else has any questions, please feel free to kind of drop them in the chat below. But we have another one here. So so it's to my understanding that both Ashey and Krystal, you work in hospital settings. But would you encourage encourage nurses to kind of go beyond that with their skill set?
I would, because personally, I've been considering IV hydration because I'm leaning into an interest in aesthetics. So I feel like that'll be a great way for me to just like get my feet wet with that and just like get into the beauty industry a little bit. So I highly encourage that. I want to pursue it myself. So that's a yes for me.
I plan to advance my degree very soon with women's health. I plan to be a women's health nurse practitioner. I'm really excited about getting into that. I also, plan to start a mentorship program for young ladies coming very soon. I encourage anyone to start a business to, definitely something that you're very excited about, definitely get into it and start a business on the side if you can. It's always great to provide more help if you can to people and just educate people and advocate. It's just great. So I would definitely suggest, maybe creating a business or some sort.
Definitely.
No, that's fantastic. So it seems that roughly that nursing looks so different. It can look into a hospital setting. It can look into the cosmetic industry. And then, there's so many different focuses and whatnot. Now, is there a particular, would you say that there is a particular interest or a specific kind of nursing specialty that, you could perhaps kind of give advice on, perhaps with your own nursing specialties? What particular concrete advice would you say that you can give for some nursing students that are watching this live?
Specialties to decide from or just in general? Because I think if you're interested in women's health, working in mother baby, NICU, labor and delivery are all great units. We all kind of work together hand in hand throughout different parts of the labor process, or even just in general. So I think that's a great specialty to be in. If you plan to be in women's health, I encourage you to go for it.
For me, I would encourage pre-op all the way because you're just exposed to so much. You are introduced to cases and just things that you didn't even learn about in nursing school. So it just allows you to branch off and it opens you up to so much things. I'm also in favor of critical care. That was like one of my favorite niches as well. It was between those two. So just seeing the things that are done in critical care and the amount of things that you do and impact the lives that you impact in critical care, because
So
people
different.
are dying and people are on their deathbeds, and you as a nurse are allowed to just be there for that patient and their family members. It's just such a significant role in itself, and I just really applaud my critical care nurses.
And what do you think, what particular skill sets do you think are really important to the nursing role? Meaning, so when you say, taking care of someone or, being legitimately at their bedside or providing them the care that they need, what specific skills do you think are really, really important?
Compassion,
Yeah.
empathy, patience, what
Grace.
else? Grace.
Grace is a big one.
An overall great spirit and presence is beneficial
Being
as well.
positive.
One of my patients did commend me on my presence. So presence is a vital factor. I will never emphasize it more enough. So those things are just very important aspects to just your daily practice and just nursing in general.
No, and I think even, again, me being in social work, I think that there's a lot of similarities, because even equally in that profession, being compassionate, being present, being self-aware, and kind of it's really kind of observed, I would say, even by the clientele that social work serves. So I can definitely kind of see those comparisons. Now, I think we have a couple more questions here. So in regards to going back to your podcast, so it will be kind of released within the next week or so.
Right.
How can folks access that podcast?
Well, you can follow us on YouTube at The Nurse Enthusiast. It will be also on Spotify. It will be on what's the other one? Spotify and Apple.
Perfect.
I think the big
Yeah.
YouTube, so you can visually see us instead of just only hearing our voice. We encourage YouTube as well as one of our biggest, platforms, and Instagram. Follow us.
No, absolutely. Is there any other questions that anyone has that they wanted to ask or say? Oh, no, we had another person join. So I guess what we can do is we can kind of start wrapping up this live.
Okay. Well, it was a pleasure.
Is there kind of any last, thoughts or words or anything that you think that we haven't touched upon in this live that you think is really important to address? Whether that be about your podcast, about the nursing profession, what wellness looks like. Really, if there's anything that you feel that we haven't touched upon, you're more than welcome to. We're more than welcome to kind of speak about that.
Well, I feel like we definitely touched on some great topics, and we've definitely touched on a lot of the nursing field, about the specialty, and just about mental health in general as what we face as nurses today. So,
nursing students, stay motivated. Nurses, keep doing your thing. And like, comment, subscribe on YouTube to The Nurse Enthusiast.
For sure.
Thank you so much for listening and coming on to live with us today.
We appreciate it. We greatly appreciate it. We appreciate talking locally.
So I will kind of make this as my last call for those. If anyone else has kind of like any other questions or any comments, if I missed your question or anything like that, please do let me know. I think I covered them all.
Thank you, Jackie.
Thank you, Jackie. We see you.
Okay. So I guess we can kind of give it another minute or so, and then we'll wrap up here.
Okay.
Okay. Let's see. Oh. Okay. All right. So I think what we can do then is we can kind of wrap it up here. So
thank you. It was great.
Yeah. Yeah, no, thank you. It was a wonderful, opportunity to be able to know a little bit more about you guys, about what nursing looks like, and to be able to talk about, your wonderful podcast. I think we're frozen. think we might be a bit frozen. We're just wrapping up here. Oh, okay. Okay, so I will wrap up this live. Thank you everyone for joining. Thank you so much for your comments and for everything. Okay, all right. Take care, everyone. Bye.